So you're still waking up in the morning with heel pain, and you're trying to figure out what the best treatment is for chronic heel pain. You may have Achilles tendonitis or pain on the bottom of the foot, plantar fasciitis. Those are the usual causes of heel pain, although you should know that an important part of your treatment is getting a correct diagnosis. Now, there's a lot of treatment options out there. You've probably learned about some of these. But every patient wants the same thing: the easiest method for correcting the problem long term. Some of you may have done some online research and run into machines like this. This is an extracorporeal shockwave machine. That's sort of a fancy word for a tenderizing machine. Now, that shouldn't scare you, because this machine actually helps treat heel pain and can cure chronic and acute heel pain. And it does this in a fantastic way that was discovered more than 25 years ago, quite by accident. It was actually discovered when experimenting with lithotripsy. That's the treatment for kidney stones. Let's get into this technology a little bit so you understand it a bit more. So this is the EPOS Ultra out of Germany. And here we have the diagnostic ultrasound component, which is located on the top of the machine. This helps visualize the exact point where your plantar fascia hurts. Now, all a diagnostic ultrasound is a fancy computer with some hardware hooked up to it that will give us an image of your foot that shows how thick your fascia is. Now, here's an X-ray of the human foot. Let's lighten it up. You notice a difference? Pay attention to the back of the foot. There's actually an enlarged calcaneal spur on the back of the heel. That's really only noticeable if the foot is lightened up or the contrast is lightened up. Spurs often occur on the backs and bottoms of the foot, but sometimes they're not recognized. They're actually missed because the KVP or contrast of the X-ray is too high. So here's our lateral X-ray view, and here's our high contrast view. And you can see that the spur is less obvious because the X-ray is darker. Now we lighten it up, and not only can we see that the spur is lighter, but we can see it's actually broken off a little bit into the insertion. Now let's turn this X-ray upside down. And the reason we do this is because this is the image we get on a diagnostic ultrasound. We're looking at the plantar fascial insertion and the insertion of the Achilles tendon, most likely. Now let's take a look at a normal ultrasound image of the plantar fascial insertion. We'll simply superimpose the image right over this X-ray. Now this is normal because the thickness at the insertion of the plantar fascia is only 3.8 millimeters, which in this case is normal. 3.2, sometimes as low as 2.5 is normal. Now let's take a look at another X-ray and we'll superimpose another image. This is an abnormal diagnostic ultrasound because it demonstrates abnormal thickness of the plantar fascia. Can you see it? It almost looks like a bicep or somebody making a muscle. And it measures 6.8 millimeters, which is roughly twice the thickness of a normal plantar fascia. And close attention to this will reveal that the plantar fascial insertion is thick and slightly black right where the heel spur exists. So, doctors all have tool sets, and these tool sets are built through years of experience. But there's one thing that all doctors should have in common, and that is that the intention should always be to get the patient from a period of convalescence to a point when they can exercise and pursue normal activity without pain. The paradigms for this have always included physical therapy and surgery. Now, surgery has a downfall, and that is there's downtime, pain, and risk. But there's new paradigms now that exist because of these shockwave machines. You still have therapy, but now the surgeries can be performed with no downtime, no pain, and very low risk. Now, we at the Feet for Life Centers use two actual techniques to treat plantar fasciitis. The first we've told you about. This machine actually treats the thick fascia with waves. But the second apparatus is called the 10x Fast Wand, and it treats the fascia and the spur by removing scar tissue. So getting back to shockwave. The shock waves are actually like giant vibrations. The waves come through and travel into the foot, creating a microscopic tenderizing effect. The guidance system makes sure that the waves hit right where they're needed. That area is variable, but consistently right where the fascia meets the spur. We keep repeating this idea that there's a tenderizing effect, but remember, it's done on a microscopic level, and that's what makes it so easy to tolerate and so beneficial. It increases blood supply, makes tissues more supple, and decreases inflammation. So now let's take a look at the 10x Fast Wand. FAST is an acronym. It stands for Focused Aspiration of Scar Tissue. There's actually two tubes that are connected to a small head. The two tubes create a flow, and the head creates an ultrasound, which shakes up the tissues and helps tenderize the fascia and treats the spur. Now here is an example of what the bone spur removal process is like. Here you can see the head of the 10x wand right at the point that it needs to treat the spur and the thick fascia. And with very little trauma, small amounts of heel spur are morcellated and brought into a small container. Okay, let's go back to our diagnostic ultrasound and let's review. Here's our normal image, and here's our abnormal image. And here's our abnormal image with the 10x wand positioned in order to treat the spur and the small black area, just catty corner to the spur. At the Feet for Life Podiatry Centers, we use these two technologies to treat heel pain with a very minimum amount of invasiveness. We're board certified by the American Board of Foot and Ankle Surgery, and we have more experience with ESWT, over 25 years of experience with our own machines. Our treatment center services these machines and is accredited by the Association for Ambulatory Healthcare. Our Heel Pain Center has performed more ESWT fast combination procedures than any facility in the U.S. The success of this treatment has made it possible for thousands of patients to get back to life without heel pain. This minimal incision approach is the result of years of experience with machines that were purchased in order to fully research and perfect a minimally invasive approach to the treatment of plantar fasciitis and Achilles tendonitis. Okay, one disclaimer. Both FAST and EPOS are registered trademarks. Due to the extreme variety of conditions treated with these technologies, no guarantee of treatment outcome can be made, expressed, or implied. Effective use of these technologies is highly dependent on the skill of the surgeon and patient compliance. Because of this, we are not in a position to make referrals to physicians in other states or countries. We hope you've enjoyed this presentation. If you would like more information, please go to our YouTube site or our website, where numerous videos on the subject of foot surgery and the treatment of chronic heel pain are available.